Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, we are going to be talking about primary herpetic gingivostomatitis. Let's start. So today I'm going to be talking about a condition which is known as primary herpetic gingivostomatitis. This is mainly a concern for parents because a lot of times this viral infection, which is caused by herpes simplex virus 1, that is HSV1, usually affects children below the age of 6 years, and this can cause a lot of concern because a lot of times parents, because of their irritability of their kids and the pain and the fever that comes in, they get very scared, thinking that this might be teething pain. Now, this condition basically is a viral infection that affects children under the age of 6, and usually it affects infants majorly. On top of that, the symptomology is as follows. You usually do not get any symptoms for a primary herpes simplex infection, but around 13 to 30% of the children, they get affected and they get symptoms like high-grade fever, they get bleeding gums, erythematous gums, they get ulcers and sores and perioral ulcers as well. There is definitely difficulty in eating and swallowing and drinking, thereby it causes malaise. And on top of that, it causes dehydration. One of the biggest complications, the most common complications is dehydration. And sometimes in rarer cases, it causes encephalitis. Now, a lot of parents, they get concerned because they actually think that the child is undergoing teething pain, but when there is high-grade fever, along with irritability, sleeplessness, malaise, and difficulty to eat and drink, as well as cervical lymphadenopathy, as a parent, it's your role to get them checked out with a pediatric specialist, a periodontist or a pediatrician, and after doing the examination, they can start the treatment. Usually it is a self-limiting condition, but acyclovir can be administered from 72 to 96 hours of the onset of fever and symptoms, and thereby it can be controlled. The dosage is 40 to 80 milligram per kg body weight, divided into 3 to 4 doses. Now, a lot of people think that they get confused between primary herpetic gingivostomatitis, where you have erythematous gingiva, you have bleeding gums, you have ulcers in around the mouth, and you have ulcers in the anterior portion of the oral cavity. As well as in later cases of diagnosis, you might have that they might start off in the posterior aspect. Now, a lot of people get confused between this and herpangina and herpes labialis. Now, herpangina is caused by a different virus. It's caused by Coxsackie virus, and it is usually seen in school-going children because of the community, involvement. At the same time, your herpes labialis is a reactivation of a latent herpes simplex infection, which doesn't have any, painful symptoms. It's usually just accompanied by, perioral canker sores or cold sores, and that's where you need to understand that primary herpetic gingivostomatitis is actually a very self-limiting condition, but yes, it can cause a lot of discomfort to the child as well as the parent, because of course it's your child's health in mind. So it is a self-limiting condition, so my only request to parents would be, do not panic. And first of all, the moment you feel that the symptoms have started, the fever usually lasts from 6 to 12 days from the onset of the fever, and the symptoms subside by 12 days. It is a self-limiting condition, but it's always better to go for palliative treatment, making sure that they are hydrated well, because dehydration is a very common complication. At the same time, you can start off with acyclovir after getting a pediatric checkup. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients or otherwise, and you can drop me a WhatsApp message, to which I will reply after 3 to 4 business days, as I get a lot of messages, I get a lot of support, I get a lot of love from my patients and my viewers. Please be patient, and I will get back to you in 3 to 4 days after your WhatsApp query. If you want to call me, please understand that I'm giving you my valuable time. If I'm asking for a teleconsultation fee, it is justified because of the fact that I'm giving you my time, and I get a lot of calls daily. So please understand that. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.